Welcome back to CTV Morning Live, our Ask the Expert segment with Chrysalis Rejuvenation Clinic. Dr. Bernie Lalonde is joining us. 789-6559, extension 2803 is the number you want to call. You can also send us a message or question to ottawa.morning@ctv.ca or check us out on our Facebook page. Didn't take long for us to get the phone calls coming in, and so we're going to get to them right away. And Connie is our caller on the air. Good morning, Connie. Connie, are you there?
Yes, I am.
Good morning. What's your question for Dr. Lalonde?
I just want to know, I've got some crow's feet around my eyes, and I just want to know approximately how much it would cost to fix it.
Okay. Well, actually, crow's feet is one of the commoner things that we do in the clinic. And you don't need a laser to get rid of crow's feet. I mean, what you need...
This is the crow's feet, right?
That's right. And if you smile for me.
Great. Put me on the spot. Okay, yeah?
Okay, well, when you smile, of course, the crow's feet become more prominent.
Right.
Okay. And so there are lines of expression, and we all have them. So it depends. If they're too deep, then if you want to mute them or eliminate them, you can do that. And the best way to do that is with Botox. I mean, you can do it with a laser, but honestly, that's overkill. And I would never prescribe a laser for crow's feet unless there was issues throughout the entire face. So in this case, Connie, I think your best bet would be Botox. And in the crow's feet area, you're looking somewhere between $100 and maybe $180, depends on the extent of them. But that's about how much it'll cost. It's going to last for about 4 months. And if you like the look, then you can keep on having it.
I think they're going to show us. So this right there. So I'm going to smile.
Yes.
And I'm going to offer you what that looks like.
Yeah, and you hardly have any at all. So you don't need Botox.
You're being really nice to me right now. But that's the issue, and it depends. You know, a lot of people, some are much deeper than others, and so it would be a filler.
No, that's
Botox.
Botox is a muscle relaxant.
Okay.
So small aliquots of Botox in areas right along this line in here, and you can eliminate that. It takes about 3 days to kick in. And depending on what you want...
So the Botox isn't a filler at all?
No. Botox is a muscle relaxant. It acts on the nerve-muscle junction. So it blocks the transmission, actually, of acetylcholine, which is the active product that causes the muscle to contract. So you block that, you can't contract, you have a smooth surface.
That's how it works. Exactly how it works. Perfect.
Did that answer your question, Connie?
Hopefully we answered Connie's question, and great there in terms of price points and how long it lasts as well. We have another caller on the line, and I do believe Lucille is on the line as well. Good morning, Lucille.
Good morning.
What's your question?
How are you?
We're great. How are you?
I'm fine, thank you.
Happy New Year to you.
Listen, thank you, same to you. I would like to know, it's because I'm on a weight loss, and I start having wrinkles around the mouth and really low on the cheek, by the nose. And I was wondering if that's fixable. I know the age is there, but it's because when I was fat, I had a very smooth skin, but now I have wrinkles.
Yes, well, and that's actually a very common situation. People who do lose significant weight find that their wrinkles come back. And as a matter of fact, some people say, well, just put on a bit of weight, your wrinkles will go away. But that's probably not the healthy thing to do. There are several options what you can do. I mean, number one, you can have fillers and maybe Botox. That's a possibility. You can do the resurfacing lasers that we just talked about earlier at the beginning of the show. And lastly, there's a process called Thermage, which is a non-surgical skin tightening device that you may be a candidate for. So really what we need to do is have a look, see the extent of the laxity, and give you your options, and then you could decide based on the information that we give you which of those three approaches you would prefer. And sometimes it's a mix. You know, you can mix sometimes a bit of Botox and fillers with resurfacing, or mix that with Thermage as well.
You know, Lucille's talking about it affecting a lot in the face, but when you have people with drastic weight loss, it's pretty much affecting their entire body, especially too if they had a much heavier stomach, then you start to see the skin folds. It must be very frustrating. They've done such an amazing job at transferring into a much healthier lifestyle, and yet at the same time... Yeah.
And it depends on the extent of the loss. I mean, I had a client yesterday who was talking to me about her son having lost a tremendous amount of weight and has this excess skin. Well, at one point, I mean, none of these non-surgical procedures are viable if the situation is so extreme. In other words, if there's so much loose skin, then surgery may be the only way to go about it. But I think in your case, Lucille, I think there's a good chance that these non-surgical technologies will work for you.
Oh, well, hopefully, Lucille, that answered your question. Congratulations, I would say, on losing some of this weight.
Good way to start the year.
Absolutely. So those were two different ways. And the Thermage, too, that's something that you were mentioning can work on the body, but also designed to be able to do it on the face.
Exactly. You can do virtually, I mean, I remember one woman about 3 years ago, we did her eyes, we did her face, we did her arms, we did her belly, we did her legs. I mean, you know, a tremendous...
And did she walk out of the office?
Her goal was actually to wear a strapless gown for the winter ball, and she achieved her goal, and she was very, very pleased with the results.
So.
Yeah.
So always different ways for people to be able to
That's
find
right. It depends, of course, it depends on your, to a certain extent on your pocketbook. Depends on the goals you want to achieve, if they're realistic. I mean, you know, we're not going to turn back the clock 20 years on anybody, but I think it's realistic to think that we can turn the clock back 5 or 10 years with the procedures that are available, and that's what most people offer.
And the best part too is just the transition, that it's non-surgical, right? That you can be in and out of the office, depending on the procedure, but you know, back at work on Monday.
Yeah, exactly. Well, Botox and fillers, of course. I mean, you can go back to work the same day.
It's during your lunch hour. What are you talking about?
That's right. And Thermage is one of the, even though it's a fairly aggressive procedure, you're back at work the next day, no downtime. The CO2, the resurfacing lasers we talked about at the beginning of the show, those are ones that have a bit of downtime, Fraxel 2 or 3 days, and the CO2 about a week.
Okay.
Yeah.
Interesting information. We do have one more segment to get to, so we're going to take a short commercial break. If you want to get your questions in, give us a call, send us an email, send us a message on Facebook. We're here to take your questions. That's all the information on your screen. And once again, after the break, we'll be joined by Dr. Lalonde from the Chrysalis Rejuvenation Clinic. We're back right after this.